everyone, today is IV day for me and it's something that I get a lot of questions about. So we thought we'd take you behind the scenes while I have my IV. I have something called Postural Orthostatic Tachycardia syndrome, which is commonly known as POTS. It's been triggered by my Lyme disease and other tick-borne illnesses. And it means that my heart rate and blood pressure regularly go out of control. And it's something that leaves me bedridden most of the week. I'm very heavily medicated for it, but something that we have found extremely useful that is used for a wide range of POTS patients is intravenous fluids. So I get fluids run over a course of an hour, and that goes into my body via a port in my chest. Initially, when I first started getting IVs, it was done through a regular cannula, but my veins couldn't handle that anymore. I then moved on to PICC lines. My veins then stopped being able to handle those anymore, so now I have a port that is implanted in my chest. I have a nurse that comes to my house and she will access it through a needle that goes directly into the port, which is surgically implanted right here. So we're going to take you behind the scenes of that today. These IVs I get on a very regular basis, and I find them to be life-changing. On days where I've had an IV, I can do things like get up and have a shower, or move out of bed and walk around, possibly even do a trip to the shop. And I know that sounds like something that is really, really small, but when you're so sick, something so small can make a really big difference. So this is a behind the scenes look at today's medical procedure.
Before the nurse comes, we make sure everything is as set up for her as we can. This is my IV trolley, and this is where she puts all the equipment once she starts getting it ready. We've got a blood pressure machine and a pulse oximeter because my obs are taken at the start of the IV and again at the end of the IV, just to make sure everything is okay. We've also got hospital grade disinfectant, and that's to wipe down the IV trolley before we start. The risk of infection for a port patient is extremely high, so we do everything we can to prevent that. Over here, we've got some more equipment. We've got sterile gloves and a dressing pack. Then we have betadine solution that will be put onto my chest before the port needle goes in, just to make sure everything is as clean as we can possibly get it. This is the port needle itself. This here is the bit that actually goes into my chest, and it connects through this line here. On the end, we pop this little valve, which is called a bung, and that just helps the IV fluid go through smoothly. Once the needle is in place, the dressing will go on top just to make sure it is secure before we start running the IV. Next, we will flush the actual port itself. So this is a little 10 ml vial of sodium chloride. It'll go into a 10 ml syringe and it'll be put into the end of the line, which will then go through the internal line in my chest that goes to my heart to make sure that line is clear before we start running the IV. We're making sure it's clear of any little clots that may have formed since the last time we use it. At the end of the IV, we will flush again to try and stop any clots forming before my next IV. The end of the line will connect to the long IV line, which will then connect to the IV bag itself. The IV bag will hang up there. The line will run down, go into the machine. This is an IV pump. I have the full setup here at home, just like you would in a hospital. And the long line will then connect back up to the line from the needle, and the fluid will drip in through that. For today's IV, we are using Hartmann's solution. It's like an electrolyte fluid, and we find that helps significantly with my blood pressure and heart rate and helps keep it regular. So this is the prep for the IV. The nurse is here and we've just been getting everything ready. That's to clean the port side, and then we've got the syringes for the flush, and this is the needle that will go in shortly. So the IV is now finished, and we're just about to remove the needle. No bleeding. This is the needle now that it's been removed, so that's what was in my chest delivering the IV to me.